Hey, Mark McKinney, owner of Amplify Texas Dental Marketing. And no, I'm not a salesperson and I'm not trying to sell you something, but I am very good at generating new patients for dental practices. And in this very quick video, I want to show you how we generated 52 new patients in 31 days for one of our clients and what the top practices across Texas are doing. Now, you know the dental field is very competitive and every practice needs a continuous flow of new patients coming in. So I want to show you the best place to acquire new patient appointments, what all your top competition is doing, and how many practices are actually wasting thousands of dollars on their marketing efforts. And I want to show you a very effective method that works better than 90% of what all other marketing campaigns in the industry are doing. And this is not hype and this is not BS. This really works. All right, let me show you some of the calls and appointments on one of our active campaigns coming in right now. As you can see, here's the dates. We go through the end of December here. And now moving into January here, you've got January 2nd, 3rd, 4th, 5th, and these are calls for appointments coming in on an active campaign we're running right now. And depending on your practice's specialty, these are some of the different types of leads we can successfully generate for your practice. Appointments for cosmetic dentistry, orthodontist, implants, bridges, laser whitening, teeth whitening, gum care, etc. All right, before I show you the quickest, most effective, most cost-efficient way of generating new patient appointments, let's talk for a minute about digital marketing. Now, we all know that digital marketing works. It's where all the business is going these days. So anytime someone's looking for a new service, we all know we jump on our phone, we jump on the computer, and we search for that service in our local market space. One of the main things we're talking about is Google. Now, Google has several spots you might end up. You've got your paid ads up here at the top, you've got the map pack, and you've got your organic results. Now, this is just a regular iPhone search for cosmetic dentist Austin. And these are the different areas you might fall in. Besides these three, another area of digital marketing is also Facebook lead generation, which can be effective as well. And then all of this, you always want to follow up all of your prospects and leads with email marketing. So what's the number one way, the top way to get new patients appointments? It's using digital marketing and it's using Google AdWords. But a warning, 95% of AdWords campaigns are actually structured wrong. They're wasting your ad spend dollars and making the ad much less effective. And let me prove this to you. Now, obviously, it's great to fall into the map pack and into the organic results. Those are great. And it's very possible, but it does require SEO, search engine optimization, and it's a long-term strategy. It takes a little longer to get your business and your website to fall in these areas. Whereas paid ads are always effective and it's instant placement and you're at the top of the page. And if done right, it can be super cost effective. Okay, in order to prove to you that most people running Google AdWords and paid ads are doing them wrong, we're going to do a little quick 1-minute lesson on what's correct and how it works. So as you can see right here, this is an optimized ad. This person's taken up a lot of real estate. They've got lots of extensions here, things to click on, lots of information. Whereas these standard ads are small, less enticing, taking up less real estate. Well, you can already see these three have failed at this one point. This one's doing a good job with their ad right here. Okay, the next point where lots of ads are failing is in using long tail keywords. Now, for instance, if you were searching for bicycle, that is super broad term. Ads are going to come up for all sorts of things. Whereas beach cruiser is a little more specific, but black 10-speed beach cruiser is super specific. And so you're going to get highly optimized searches for people looking exactly for what you offer. For example, if you searched cosmetic dentist Austin, you can see that the very top search here uses that phrase exactly, cosmetic dentist Austin. This one, Austin Cosmetic Dentist, is in a different order. This one has an additional word. In order to be completely optimized, every one of these should have that exact line in their title if they were completely, fully optimized. For example, if we look here, Cosmetic Dentist Dallas, Restore Your Smile Permanently, Cosmetic Dental, Austin, this one's the wrong town even, that's very wrong. None of these, when you search this, none of these have that phrase, that long tail keyword search term in their title. Well, they're losing money then. They are not optimized. Let me show you. Google AdWords uses a formula to determine how much you pay and where you rank in the ads. For instance, your quality score and then your max cost per click, the maximum amount you're willing to pay per click, equal your ad rank. So if your quality score is very, very high, like right here, you might actually pay less and be the top ad, and people down ad number 4 might be paying 2, 3, 4 times as much as you. Now, how do you become optimized and have a quality score? Well, you have that exact search term in your ad, just like I showed you that no one in the Dallas Cosmetic Dentist ads had. So a huge mistake that most people do in AdWords are making is they're pointing multiple keywords to just one ad. And in their campaign, they might have a second ad, but they've got multiple keywords and long tail keywords pointing to that same ad. Well, it's going to have a very low quality score. Google's going to rank it low on quality, and they're going to charge more per click. Whereas what we recommend and what works way better, it's called the one-to-one method, is to put one keyword to one ad group. So it ends up looking something more like this. Every single ad has its own specific long tail keyword or short tail keyword that goes directly to that ad, instead of having tons of keywords pointing straight to that. This is going to cost you more and going to be much less effective. So back to our example here, when you search Cosmetic Dentist Dallas, you do not find that search term in any of the titles of any of these ads right here. They're all making a big mistake by not doing that. Another example, we search Houston Cosmetic Dentist, and as you can see, that search term does not show up anywhere in here. Now, like we showed you in the Austin one, Cosmetic Dentist Austin, right here at the very top, Cosmetic Dentist Austin, they've done that correct. These close, but every one of these Austin Cosmetic Dentist should have its own search term, its own search ad. So using some spy software here, we can actually go back and analyze everybody's AdWords, and it's not perfectly accurate, but it's usually pretty close. And you can see here an ad budget of 5,000 plus, and you know that they have lots of search terms for different ads, because look, they have 631 paid keywords, whereas somebody over here only has 231, only 33, 304. Ideally, you want to have this over 1,000. You want to have lots of search terms and long tail search terms so that your cost and your quality score goes way down, and you pay less and you get more specific searches for exactly what you're offering. We can look here at a business out of San Antonio, Cosmetic Dentistry of San Antonio, or of SA.com, and you can see, we can go back and we can look at all their ads, what ads were most effective for them, and really analyze what search terms worked best for them. So when we build a campaign, this is a lot of the information that we use. I hope this gave you some value and helped you understand a little bit more about digital marketing and the effectiveness of Google AdWords and how it works. What we do could be a great addition to your current marketing, or you might want to replace your current marketing with this. It's very, very effective. Maybe you have someone right now doing Google AdWords for you, and this will give you a chance to evaluate if they're doing it right, or maybe you might want to have it done much more effectively. My name is Mark McKinney. Give me a call, email mark@amplifytexas.com. I would love to talk with you and see what we can do to form a win-win relationship. We only work with a limited number of practices in any given area, so we're very selective, and we want to help you explode your business. So give us a shout. Hope this helped. Thanks.